Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Welcome everyone to Cracking Cancer. I'm your host, Dr. Kyle Concannon, and with me today is Samantha Morrell.
Hi everyone, Samantha here. I am a patient advocate with stage 4 non-small cell lung cancer with a HER2 mutation. Great to be here.
Thanks for co-hosting as usual, Samantha. And
Of course.
I'm a physician scientist currently at MD Anderson. And today we're going to be talking about oncology trends in social media. We've seen a lot of different oncology reels and things from patients, things from providers that really range a broad array of credibility. Some of it seems, skepticism inducing. And not, I think we have to figure out as a field how do we feel about these things? How do we interpret them? What stuff seems credible? And, what are the emotions that come up when we're seeing all this stuff? Like, how do we hold each other accountable for what people are putting out there from all sides, really? So I think this is one podcast probably of many, because this is an evolving field, and I don't think these posts are going away anytime soon. So first, starting off, Samantha, I'll put it to you, like, how much of the content that you're now seeing, being a lung cancer patient advocate, how much of that content is this stuff, these recommendations coming from people, what you should be doing, what worked for me, anecdotal evidence about what cures cancer? Yeah, how much are you getting hit?
Oh boy, this is my favorite topic, so I'm glad we're talking about it. So yeah, I'm on Instagram a lot, and I go through Reels a lot. And if you have the right algorithm on your Instagram, you will get a lot of this stuff. And sometimes you'll see a reel that will pique your interest on an alternative therapy, and you'll think that that's a good idea. And then the next day you'll scroll again and you'll see something that completely says the opposite of what you saw the day prior, and then that confuses you. And so for me personally, I wanted to do all of these alternative therapies that everyone was recommending. And I almost felt like I was failing as a person if I wasn't doing all of them. And it's like, how do I know which ones are legit? How do I know which ones are just people wanting to get likes and clicks and pushing their own brand? I don't feel like I should be the one that has to do the research to find all this out, but unfortunately we kind of do, to make sure that we're going down the right path. And so it's great that we're having this discussion and having an expert in the room here, because you can kind of talk about scientifically, like, some of these opinions on whether they make sense or not.
Yeah, and it's challenging because, one, I think from a provider perspective, I'm not in the same sphere. So I don't see a lot of that in my daily life. I hear a lot of it now from you.
Yeah.
So you're the one that's like, hey, I came across this thing. What do you think about XYZ? And I was like, oh, to my knowledge, I have no knowledge that this does anything, but this is, frequently the first I'm hearing about it. But you're like, it's all the rage. And then I look into it and I'm like, okay, well, I should be talking or learning more about these things. Because I think a lot of patients, I mean, tell me if I'm wrong, but a lot of patients see this stuff on social media, and some of it seems skeptic, like I'm saying, it doesn't seem super credible. So you might not want to talk to your oncologist about it because you don't want to sound dumb, but you might still do it. Like, it may not be harmful, but, so I'm wondering, when you come across these things, what's your mechanism, or like, what do you do to vet it? When a given reel comes through that you think you might act on.
So first of all, I look at and see if they quote like a journal or a study or something, rather than just like anecdotal, I cured myself. Because you'll have a lot of people that have a stage 4 diagnosis and will say that they cured themselves with this approach. And um, I don't know. It's frustrating because it's like such a blanket statement that something so basic could cure you, and it almost feels like, oh well, why aren't I doing that and why aren't I curing myself? But actually it could be dangerous, or it could interact with the treatment I'm on, and like there's no recourse or action if the person saying this stuff says what they do and then I do it and things backfire on me. Like there's no recourse there. So to vet, yes, I look at journals and studies. I'll often ask Chat GPT what they think. I don't really go to my oncologist because I don't want to seem like an idiot in most cases. But I'll also ask like other people, like in the Young Lung group, if they've heard of this, if they've tried it or what have you. But and sometimes I just go with my gut, which is probably a terrible idea too. But
Well, it's interesting, and I'd love to talk more about the phenomena of these anecdotes where I did X, Y, and Z and I cured my cancer. I'd
Mhm.
love to talk more about that, you know, but to your point, I think you said, I trust my gut and I want to see how that feels. And I think there's, probably a grain of truth to that. There's a lot of things that they just don't seem, it seems too good to be true because it is.
Absolutely. Yes.
If you
Yes.
drink this, if you eat this 3 times a day, and intuitively you're like, well, like, why would that be a thing?
Mhm.
But I think the harm lies in, um, because it's not harmful to do it, or because it's so easy to catch on, the risk is low, so people do it, and then that breeds hope, false hope.
Yep. Yep.
And I think that's just so damaging.
It is, and I don't know why people are so sold on some of these things. Like really, like I don't even think it's malicious half of the time. It's like they
Hmm.
genuinely believe. And like even on my Instagram reels, I'll have comments from strangers being like, have you tried apricot seeds? Or,
Hmm.
like, why aren't you doing methylene blue or what have you? And thinking like, they've just given me the answer and cure to my cancer. And it's
Yeah,
like, but I think they genuinely mean it.
I
And
think so
like,
too.
I respond to a lot of these people and say like, oh yes, I've tried it, or not for me, or what have you. When I say, and it's kind of funny because when I say like, oh, I have tried it, they go dark,
Oh,
because
really?
it's like I say like, oh, I've tried it and it didn't work, or I've tried it and I
Yeah.
didn't show benefit, and then they just go dark, um,
Do you
which I
think the
find really interesting.
Me too. I mean, do you think that the person relaying that, I'm trying to put myself in their position. They're trying to help. These are the tools they have.
Yeah,
And they've seen a lot of people really supporting it, and they want to believe in it. And then, they've offered their lifeline that they can offer. And you're like, it didn't work. Do
yeah.
you think for them that's a feeling of they're trying their best and it failed, maybe some embarrassment, or like, what do you think they're feeling? Or do you think they're pushing clicks and you're
Yeah,
like,
I mean,
not gonna bite?
it could be bots, right? It could be bots
Could be
commenting.
bots. Yeah.
um,
What a world.
but I think it's that they are just so sold into what they've seen in other reels or other
Yeah.
podcasts or what have you, that they truly believe this is the savior and that it should work for me. And if it
Yeah.
doesn't, then that's weird and you're weird. And I try to explain, like, even more so with my cancer specifically, I have a mutation, right? So I'm not a bog standard, say bog standard, that's probably not an appropriate term, but I am not just blanket non small cell lung cancer. I have a mutation. And so oftentimes I'll respond and say, because they'll say, oh, this worked for another person that had lung cancer. And I'll explain that in some cases, when I can be bothered to, I respond and say, I have a mutation. It works very differently. And a lot of the alternative therapies you're recommending just don't budge the needle on people that have mutations. And I use that as an educational moment. And maybe it maybe it helps educate them, maybe it doesn't, but it puts a stop to the further badgering, I think. And yeah, for the people that have, standard lung cancer without a mutation, there are these anecdotal stories of certain things working. There aren't with people with mutations that I have found anyway. And so that's kind of my out, but also my justification of not trying it, because my mutation is going to do what it's going to do in its own way. And I don't think a lot of these alternative therapies are going to solve that.
Yeah. And I think, you know, something you've hit on is you've identified the element in your cancer that makes it largely unique, which is this oncogene that you have, that your cancer has. And a lot of other cancers, they have a thing, we just don't understand it. So I think people struggle to identify or to really wrap their head around how unique each individual's cancer is, because for the long time we haven't had really good tools to like figure that out, and we're still working on it. You know, all the stuff that's non-mutated with these driver oncogenes went wrong somehow. We have some understanding, but they have different vulnerabilities. Just like yours has a vulnerability in that oncogene, other things have vulnerabilities too. And some of those are metabolic. Now, that doesn't necessarily mean that cutting X, Y, and Z out of your diet is going to change anything. But I think a lot of these good intentions and a lot of what people are trying to push is based in threads of threads of evidence. Like the principles aren't bad. And I think often the intent isn't malicious, but it's tough because you're the person on the receiving end of this. And you use the term badgering because it's like there's an expectation there. I feel when someone says, I want to help you do this XYZ thing, it's going to cure you. And you're like, do you have any idea what you just claimed?
Yeah,
Like, do you have any idea what you just did?
right.
Do you think they feel the gravity of that?
I don't think so at all. And I think there's so much pressure. And I talk about this a lot on my Instagram reels too, where we see so much on Instagram. And I feel that there was a point in, so like December of last year, when I didn't have so great scans. And my way of controlling the situation was doing like every alternate thing you could think of.
Mm-hmm.
And, it would consume my day. It wasn't just taking things, it was like doing things. And it was consuming my entire day because I felt this innate sense of pressure to do it all in
Mm.
the off chance that it would all together
Yeah.
make my cancer better. And I was exhausted, like mentally. And I had a talk with myself and I was like, is this how I want to live? Like
Mm.
if it makes me happy, do it. If it provides benefit to my well-being, do it. But don't just do it because everyone is saying you should do it. Because then it's like, why are you wasting your time? Unless you feel like there's a benefit to you, like don't feel the pressure of doing it. Because it was awful. I got like my husband was like, "What are you doing now?" And you're doing that. Like it was just like, okay, 9 o'clock this, 10 o'clock this, 11 o'clock this, and it's just
Yeah.
like, holy crap! Like
Well,
I
and
need to
so,
just live.
yeah, I mean, something you said there, I think really bears repeating, which is if you don't feel it's going to have clear benefit to you, don't do it.
Right.
And I think that is a really powerful statement that spans not only the realm of alternative medicines, but also conventional medicines,
Yeah.
like also the stuff that we prescribe, because those are judgment calls too.
Yeah.
So this is, I think, such a true fundamental paradigm that you have to approach with so many decisions,
Absolutely.
you know,
Absolutely.
and like how many things were you doing? Because the pitches are endless.
Oh, 100%. 100%. I was doing 3 different types of breath work. I was doing cold plunge and sauna. I was doing qigong. I was
Mhm.
doing acupuncture, like all the things. And some of those, yes, they do provide me benefit, but like I realize let's stagger them out throughout the week and I'll get benefit from each of those things at times when I need them and they make me feel good, so I'm gonna do them. But like, if they don't make you feel good, don't bother. Don't feel that Instagram pressure. And I think the proof is in the pudding for me personally, is that I was doing all these things and then I had a bad scan. So like,
Yeah.
all the things I was doing wasn't suddenly curing my cancer. Um, yeah, so just do what makes you feel good. Like I do Wim Hof breathing every other day because it makes me feel really good. It feels good in my lungs. Um, it makes me just feel better. And so I do that. I've stopped cold plunging because for me personally in the wintertime, cold plunging is not the best thing for me personally. So it's finding out what alternative, and this is unrelated to like things you actually take, right? Like
Hmm.
just different therapies, like just find out what works for you and your lifestyle. And if nothing works for you and your lifestyle, don't do it. It's okay. And Sally, no offense to someone who's called Sally, but Sally who says like you
Calling
should
out one
be
specific person.
Sally who says you should be doing going to the sauna 7 days a week to reduce your inflammation so that your cancer doesn't get worse. If that's not in your capacity financially or time wise, because you're managing and juggling a family, like it's okay. It's not going to cure your cancer. It really is not. And I'm not an oncologist, I'm not a doctor, but these therapies are not going to cure you. It's just they might make you feel better in the moment. And if you don't have time for them, that's okay. And, a lot of people who are younger too, like the juggling, having cancer, having a job, having a family, the financial toxicity, like there's a financial load on top that we haven't even touched on of like trying all of these alternate therapies because they're costly, they're very expensive. And there's a lot of people on Instagram trying to get your money.
Yeah.
So we talk about it not being malicious. Most of the time, it's not. But sometimes people are trying to get that financial money off you because they're digging into an area of vulnerability that you have.
Yeah, and that definitely I think is going to hit a nerve with a lot of folks who are
Yeah.
listening, and it hits a nerve with me too. I've had patients who had curable cancers, and then they go to a clinic somewhere that offers an alternative therapy that doesn't have science behind it, but it sounds like it would be really good. And they do that thing for a couple of months, and then they come back with brain mets, and all of a sudden they're not curable. And I think every oncologist has that story. And I do understand that a lot of people look at the cancer treatment system, academics, private, and they do have, I'd say, a healthy skepticism that that also needs to generate revenue in some way. No margin, no mission. You do need money to continue to help people. And I think it's true to have a healthy skepticism and look at that objectively. So I get it. Like it's hard for the patient to discern which things are credible, which things aren't. You don't want to put chemotherapy in your veins as much as some of these non-toxic alternatives. But that's a tough field to navigate. And as someone who's watched people that you grow to care about your patients, and you don't want to see them die. And when something unnecessary like this happens, that's preventable, and you see someone else profiting off of a decision that they probably know, but would like to believe, that situation where they're going to say that it helps, but there's no evidence that it helps. And you check their notes, and their notes all say, in conjunction with a medical oncologist, where we're not advising this against therapy. This is to support. So all their notes say the right things, but they're not getting cancer therapy. They're getting something else. It's really hard to watch that. Um,
Yeah, and I've seen a lot recently on Instagram Reels too about how, you know, whoever it is out there knows the cure for cancer and they're just not saying it. And then the other one is, and to some degree, this is an interesting perspective, but like the people producing some chemotherapy drugs are also the people that produce pesticides and things like that. And like, um, so there's a lot of that out there,
mhm.
and like again, it just makes me, as someone who has cancer, feel like shit, honestly, because it's like, okay, cool. What do you want me to do with that information?
Yeah.
There's nothing I can do, really. I mean,
Well, and believing that
so
doesn't help anything.
right, right,
I
right.
think that, and that sentiment where the cure for cancer is known and we're just withholding it is pervasive everywhere. I've had nurses talk to me about that.
Mm-hmm.
And, they want to know, do you guys really understand it? And I think there's a few arguments, I suppose, that we can say that will dispel that a little bit for those who are willing to believe it. Is one, you'd have to convince a lot of people to not talk. And
Mm-hmm.
all of those people would have to be morally corrupt. The likelihood of that happening is pretty low. And before we're medical oncologists, before we're working with pharmaceutical companies, which many of us do, because those are the people who have the medicines and who make the medicines, before that, we were people who wanted to help cancer patients. So the argument has to be like on one day, on a dime, you just were like, never mind. Like, I'm going to go do this now. And that's just not how these vocations work,
Mm-hmm.
because there's a lot of sacrifice down this path. There's a lot of delayed gratification. You really have to believe in the mission for a long, long time before you get to be that thing, which is, an oncologist or whatever provider. Um, but also, people who would theoretically have the cure would want to monetize that. You know, like
Yeah.
we've had examples of these in the past where a complete breakthrough happens. One example was in chronic myeloid leukemia. There was a drug that came out and it was called Gleevec, imatinib, and it completely revolutionized the field. And there are other examples like this too. But essentially, it turned a universally fatal disease, this type of leukemia, into a chronic illness where people largely live normal lives. And they did not withhold that, but they
Right.
did monetize it quite a bit. That was
Yeah,
very,
I'm
very
sure.
expensive when it came out.
Yeah.
Um, so yeah, I mean, you'd better believe that everyone and their mother would be on this medicine if it prevented cancer, and every cancer patient would be paying, you know, $8 million for the cure. So yeah, I think people would, if your viewpoint is from economic perspective, like they're going to want to monetize that. That's their whole,
100%.
they have, and then they would monopolize the game. Like they would be the only game in town now. So yeah, they would definitely do that. Um, but also, I mean, there's just the moral perspective. Like these people have families. The people who go into pharmaceutical companies are often people who were in academics and they went through the same training and everything I went through. And you're doing your stuff to help people. That doesn't change just because you went over to the pharma. You took a different job. So I think there's a lot of things that would have to go wrong for that to be true. And I, for one, don't believe it. Um,
Yep. Well,
but it's out there. You see it all the
it is
time.
out there. It absolutely is. Um, so I want to ask you, so with, some of the reels I do see where they publish like real research, right?
How is that spelled? REEL or REAL?
um, like what should I do with that information?
No, but really, when you say real research, do you mean like the anecdotes from a reel, or do you mean
Well,
like
oh, okay. Fair
yeah,
point.
like
Sorry, fair
joke,
point.
not joke?
Real research as in REAL.
I see.
Yes.
I mean, it's tough because just because something is investigated in some way doesn't make it credible. Your conclusion is based on a number of factors. So just because someone says they did a study and it showed X, doesn't mean that the study was conducted rigorously. Like it doesn't mean that all the assumptions that you're making in your head, they did. So it doesn't guarantee that. You can publish a lot of stuff. It also doesn't guarantee that it applies to you. Good studies typically are done in a pretty narrow scope because the more you generalize, the harder it is to interpret findings. Generally, studies are experiments, and in any experiment, you want to minimize your variables. So those are some things to consider. But then, usually in a study, if you get down to the discussion part of the study, they'll have limitations, and they're expected to say why why their study was faulty, and all studies are faulty. Just some are more faulty than others. So no study's perfect. No, uh, no interpretation is going to be totally perfect. But I think that's a thing that a lot of people, when you're just looking at a glance conclusion, there's a million caveats there. So it's really hard to look at something and really have to believe it applies to you. I mean, even if I said in lung cancer patients with HER2 driven lung cancer, XYZ, I couldn't guarantee it applies to you. Like there are still other things I would want to see out of that study. And that's a pretty specific study. Most of the stuff that people are looking at says cancer. So when you're just at this broad thing, acting as though all cancers are the same, all stages are the same, all prior treatments are the same, there's so many variables that you're ignoring. So I think if you're going to come across some study on social media, my first strong recommendation would be to take it with a huge grain of salt and assume it doesn't apply to you. And then, you look more into it, like read the study. I think people only get better at this stuff by practice. And if you have access to the full study, read it. Think about it yourself. Were there enough patients? Was the magnitude of the effect good enough that it would be meaningful for you? Were the patients representative of you, or were they all, in a different system that has different therapies? So think about those things. Does it really apply to you? And then, go through the study and see how rigorous was it done, how many people were involved, over what time period, was it done in the 70s? Like, there's so many assumptions that we have when we see these one-liners, and almost all the time it's not going to apply to your specific situation.
Can we talk about mice too? Because you taught me a little bit about mice in the past, in terms of there's a lot of reels that will quote studies, and then I go down a hole and I realize it's a mice. And then people say, oh, well, it's still applicable, blah, blah, blah. But you kind of educated me a bit more on that. So if you can share with the group.
Yeah, I wouldn't consider myself a mouse expert, because some people who listen to this, that's a whole additional field of cancer biology, is which mouse models to use. And it's funny, we use the
Okay.
term mouse models, and that just means the scientific model, the type of mouse. My wife would laugh at me when I was talking about mouse models because she's thinking of mice like on a runway. That's not what we're talking about. There's
Well,
no
I
mice.
am too.
Yeah,
Okay. So
yeah.
we're not talking about
Now
that.
that I've said
Okay.
about it, it's like, well, actually, let's talk about that. That's way better than what we were going to talk about. Um, but yeah, so let me explain a little bit as to what most mouse models are. Most of the time, when someone uses a mouse model, what they're talking about is a mouse that is, fairly young in terms of, mice lives, and they're usually immunodeficient. And that's important because what we do to this mouse, for most of the studies that are in my field at least, is they'll inject tumor cells into, like, under the skin of the mouse, and then they'll grow a little tumor on it. And then you can, change mouse's diet, you can give different therapies, and you see how that tumor might change. You can biopsy the tumor because it's right there under the skin. And the tumor that you injected is a tumor that was made from a human. So, for example, how this might play out is if there's detectable tumor, let's say you have a lymph node, that is positive, that is tumor there. We can biopsy that lymph node, put that in this flank of a mouse, the side of a mouse, and if the mouse is immunocompromised, its immune system won't go in and kill the cancer, which it would otherwise do.
Hmm.
And then we can use that to say, okay, well, in a system that has a bloodstream, it has perfusion, and in a model, in an organism that has organs, so you can tell if what you're doing would kill the thing. Can we do these perturbations? And by and large, a lot of the data that you're going to see out of a mouse model will overrepresent its effect in humans. It's pretty easy to cure cancer in mice, is the reality of it. And think about this. We have a lot of early phase trials that happen. And the vast majority of those early phase trials, meaning it's the first in human, we haven't tried this in people before, most of those don't go on to be successes. But the data that made us try was in a mouse.
Mm-hmm.
And usually it was in a mouse model. It did really well. And then they tried in a human, and, the mouse didn't see 3 rounds of chemotherapy before. And the mouse tumor isn't in their liver or their lung where this one is. It didn't derive, it didn't come naturally. It doesn't have an immune system that can, be another variable that's added in here. So there's a lot of assumptions you make with the mouse model, but if it doesn't work in mice, it's probably still not going to work in humans. If it does work in mice, it might.
Yeah.
That's
Yeah.
probably how I'd phrase it.
And there's a lot of studies that people pull on that are mouse models, however you say it.
Yeah. Yeah.
And then also you and I talked a little bit about the dosage too, right? Where if you really did the math on something, the dose would be so high that in a human that you would likely have severe side effects or die or what have you. And so there'll be a claim that X thing will cure your cancer, but it's in reality that dose is so high that of course it's going to cure your cancer because you're going to die or
Yeah.
just have extreme side effects. Or I'm sure you can speak far more articulate manner about it, but
Yeah. When I was in undergraduate and then throughout medical school, my undergraduate minor was pharmacology. And I learned a lot of this stuff. And then you continue to learn it in med school and then in the laboratory. Um, but the only thing that separates something that's beneficial from it being beneficial versus a toxin is dose. That's it. You can overdose on water. You can overdose on any vitamin. Like if the dose is too high, anything can kill you. So it's really important to keep that in mind when you're looking at these studies that are looking at things in culture.
mm-hmm.
Because a lot of people will see this type of drug that does this kills cancer. And anything will kill cancer in a petri dish if you use enough of it.
Yep.
Truly.
That's what I meant. That's what I was trying to say. But yes, I didn't
Well,
say that well enough.
yeah, no, if the doses are too high, then you can get either the drug will start binding to things that it wouldn't usually bind to, and just chaos ensues at a molecular level. But also a lot of times we use these drugs as tools. So you can, think of it as we're using the drug in the cell line uh, to shut down a certain system. So even though it's much higher than you would do in a patient, we're learning something about the biology. And maybe the cancer cells die, but like we know when we're using it that you wouldn't do this to a human. We're just doing it to, I don't know, I'm going to shut down the mitochondria. So you might give a drug at a really high dose because it causes an effect, and then you can see what other things might compensate. But you would never do that in human. But the person who's reading the study, third hand, or who's not familiar with those techniques, isn't going to necessarily think of that. And I wouldn't expect them to. So it's really hard to interpret a lot of these studies. But I'll say you can probably find a preclinical study that will support whatever you want to find, in both directions. Just because dose can be measured, to the point we were talking about earlier, not all cancer is the same. And if you're just seeing it in one model, the more likely event is that they looked at it in a few models, a few different types of cancer, and it worked in one. And that's the one they published. And if you don't see it in a mouse, it doesn't mean they didn't do it. um, they might have just not published that data because it didn't support the hypothesis or because the mice all died or something. And, people aren't super interested in publishing negative data. So there's a lot of, in training, we call it the hidden curriculum when there's these other things you don't know about. And there's a lot of hidden science here too, that someone who's been on the other side and has some experience in reading between the lines can pull out, but there's a lot there that you may not be able to pull out just by looking at it.
Yeah, and I think I'm very fortunate because you're kind of my debunker. So I get to share this stuff with you now, and you're like, no, that's
Yeah,
ridiculous.
nothing works.
But I,
Everything's wrong.
but I think it's hard because you'll get the general population person doing a reel about something because they pulled something from a paper, but then you'll also get like legitimate doctors who do these stuff, who do these things too. And I think that's what makes it even more confusing is when you have a legitimate doctor who's very into what they're saying, and quoting, and you're just like, this person really believes this and they're a doctor, and we're supposed to trust doctors to some extent. So I don't know if you have any wonderful insight there on that, but like it's hard, especially when it comes to those people that have gone through medical school, they've gone through all their training, and they're quoting these out there things that could potentially cure a cancer or my cancer or what have you, and like it's hard to not really think that that's a thing.
Yeah, it's tough. I think those are case by case situations, particularly when you're talking about people within the medical field. And I think there's a few possibilities. One is that there's someone who really knows what they're talking about, and it's possible they're right. Like that's true. You don't know that that's not true. Typically, I have seen people who do have strong credentials and they post something, and I think they're reading the tea leaves a little bit more. They're extrapolating a little more than I would feel comfortable with. Um, but it's also possible they know something I don't know. You know, so I'm not above the humility of hearing some of these things and saying, there may be something to it I don't know. But I do think if you're going to come out and make a pretty bold claim that XYZ is going to cure cancer or something's really going to help you, you need to have the evidence in hand now, like immediately. Um, and barring that, I'm not going to believe it, at least not without some of my own independent vetting. And then, for other people who are, um, posting these kind of threads of information that are in the medical community, but maybe not that expert, because the spectrum is wide. You have the people who are really strong experts. They do preclinical research. They're the ones doing the mouse modeling, and they can over extrapolate too. Like we're all human. We all have our beliefs, and some are held on their experience and everything. And they may not have the data, but they do believe that. And then you do have people who don't have that same level of personal academic rigor in that field, but they work in that field and they've read some, they're well read in it. But even then, I think it's really hard to make strong conclusions without having done the definitive evidence, or without having that in hand. But people, I think, by and large, are trying to help, unless they're the one that's directly profiting off
Right.
of, once you inject bias,
Hmm.
and profiting is 100%. There's no way to avoid bias if you're profiting.
Right.
So it's just something you need to be aware of. Um, so I think, they're still probably coming from a really good place, but I do think there's become this pervasive atmosphere where people are comfortable making really bold claims online because
Yeah.
there is no real accountability being
Right.
held. And I'm probably struggling to navigate that as much as well, maybe not as much as you are because you're the one that has to make decisions on it. But I don't have a full answer except to say I don't trust anything.
Yeah.
Unless
Yeah.
they have the clear evidence. I don't trust anyone saying that something's going to help me.
Yeah, and I think in other podcasts we're going to delve into some of these claims a little bit and just talk about them and discuss them. And, I say this to you all the time, Kyle, like I am very much an alternative therapy person. So I'm not by any means trying to bash every alternative therapy because I do truly believe for myself anyway that some of these things I'm doing do help. I even have an integrative oncologist that I have separate to my oncologist, and I work with him, and he uses data just like we talked about, and papers, and of what different vitamins might benefit me personally. But it's very catered towards me specifically and what I have. The danger is when you're looking at Instagram reels and, like you said, you're generalizing, right? Because not one size fits all with cancer. It's so particular to who you are and what you have. And my integrative oncologist has been phenomenal. And I will say, like, if you have the financial resources and you are interested in alternative therapies, try and find an integrative oncologist that will work with your oncologist. There is benefit to it. Don't go off Instagram reels, please. Please don't. It's so dangerous.
Yeah, and I mean, most oncologists are very comfortable working with, alternative therapies, integrative medicine. It's really only becomes a problem if they become opposed. If what you're
Yeah,
doing is harming you, then we're going to be advocates against it. And that's not usually the
absolutely.
case. Sometimes
Yeah,
it
I
is.
mean, you have no idea what treatment you're on, what vitamins you're taking, how they might be interacting with your treatments. And the last thing I want to do as someone who has stage 4 cancer is to limit or inhibit my cancer treatment from working because of a vitamin I'm taking that might help. That is absolutely terrifying, right? So ensuring that your care team know what you're taking, I think is paramount, and working with a pharmacist to ensure they don't know of any known interactions, like that is so important. And in the underground, I call it the underground. In the underground, there's a lot of talk about, like, well, I can't talk to my oncologist about the vitamins I'm taking because they're going to judge me or they're going to poo poo it or what have you. And, my undoctor opinion is if you don't feel comfortable talking about that stuff, you have the wrong oncologist. Like,
I
if
share that.
you if you want to try alternative therapies, find an oncologist that's okay with you trying them within reason, that they're comfortable with also. At the end of the day, it's your life, but
Well, and
you're
you're paying
working
them
you're
like they
working
work
with a
for you.
team. Exactly, exactly. And my oncologist has always been, I gave him a massive list when I was first diagnosed of everything I was taking. And the pharmacist just said yes or no. And I think they literally said no to like 4 things out of the 30 things I was taking. And quite honestly, that took me aback because I was waiting for them to shoot down like all 30 of them. Because I had this perception, like many people do, that conventional treatment and conventional doctors will immediately shut down alternative therapies. And that's just, it really isn't the case.
No, I agree. I mean, tons of people take many supplements and under a lot of different things. And the concerns we have are are they going to change the metabolism of what we're giving? So
Right.
that could be it can either lower your body's ability to metabolize chemo, it could increase the ability to metabolize chemo. One's going to lead to side effects, one's going to lead to it just not working. Um, or, I say chemo, whatever therapy you're on. And then some things can share toxicity risks. There are
Mm-hmm.
certain things that one could take that'll be really damaging to the liver, and we don't want to give that with a therapy that also has a risk of damaging the liver. Like, I don't want to put you in a liver failure. Um, beside that, there's a financial risk. Like some of this
Yep.
stuff is not cheap.
No, it's
And
not.
yeah, it's not all at Whole Foods. Um, and not everyone can afford it. And when we don't have any
Right.
data that suggests it works, and we're seeing the guilt that the person's feeling. I mean, I've had this
Absolutely.
conversation a bunch of times. Someone
Yep.
has this thing that they bought from XYZ country that, a loved one lives there and they got it from who knows, and they paid a lot of money. And you have to say, like, I don't know what this is. I really don't feel comfortable with you taking it because I don't know if it's going to interact with our stuff. I'm pretty sure this isn't the realm in which effective therapies come to light. Um, so it's tough, but when those conversations happen, it's not from a place of judgment. If I'm telling someone to not take something, usually I feel bad that they paid for it, and I have to have a pretty high concern to make someone eat that cost. Because my whole job is to help the patient meet their goals in the context of where they're at. Like that's what I do, and it's um, if they end up wanting to leave and do an alternative therapy that they see on Instagram or TikTok instead of whatever I recommend, like they're allowed to do that. It's their life. And if they come back and say, "Hey, I'm feeling bad. I think my cancer progressed. That was a mistake." Like my job is to help them. It's not they're the ones that deal with the consequences. And even let's say that situation plays out, like that's when someone needs support more than ever. Is when you've tried something and you tried an alternative therapy and it failed. Like this is
Absolutely.
when you need help.
Yep. I do like talking about the underground stuff though with you because I don't think a lot of this stuff, I mean, a lot of this stuff is on Instagram, but like it's not talked about with an actual oncologist like yourself. So it's like I don't know, it's good to get it out in the open and talked about because there's just a lot to unpack there, like a
Well, I'm
lot.
interested in the guilt that is accompanied with hearing about this stuff because I've seen some of the things you sent me, and it just seems they're pulled out of thin air. Like none of it seems to have any many of the things don't really have a hypothesis behind it. It's just like, do this, it cures cancer. And if you have a million of those, you it's impossible to interrogate all of them.
Yeah.
Then you just kind of have to see how trustworthy does this person feel, how likely am I to make this change? Like, is it easy to do? Like, I don't know all the things that go into the decision making, but all
Yeah.
of them, there must be some level of guilt of what if.
Oh, so much. So much guilt.
Yeah.
I saw a reel the other day where it was a lady, I think I shared it with you. It was a lady injecting herself. It was like a video of her literally injecting her belly. And it was saying if you inject yourself with this item, I can't remember what it was, but this could cure your cancer. And then people were like, okay, well, how did you get a hold of it? And
Yeah.
she's like, oh, no, I'm not actually injecting myself with that product. I'm just injecting myself with something else. But I'm just showing you that that's how it will be done. But unless you read those comments, it
Yeah.
looked like she was injecting herself with this item that would cure her cancer that no one can get a hold of. So you really have to dig quite deep into the reel to like really figure out the facts. And so
Well, and they can lie.
well, 100%,
Yeah.
a
Like,
100%. I mean, they can claim whatever the hell they want.
mhm.
So the guilt is so much, and there are some vitamins that I tried for a period of time and stopped, and I still get asked by people like, "Have you tried this?" And I'm like, "Yes, I have," but like, I re-guilt myself when because I had a justification in my head on why I stopped them and it made sense to me. But when someone poses it again to me, I'm like, oh, damn, maybe I should still be on that. And like, it's a continual cycle of just like, I'm failing myself or the what if. What if I stayed on this for another month? What if I tried this thing for 6 weeks. And a lot of the claims on Instagram are like they're curing their cancer within a matter of weeks and months, like a very short time span of taking something, which I think is even bolder to claim. Like, if someone said, I took these for 3 years and they cured my cancer, I think I would have more intrigue. I would be intrigued more than if someone said I cured my cancer in 6 weeks by this. But yeah, it just makes you feel like a failure. And I don't have a solution to it other than change your algorithm on Instagram and don't look at it. But it's just a part of our lives as someone who has cancer, and we just have to deal with it, and it sucks.
Well, and in the middle of these feelings is a belief that the stuff you're seeing there is different than the stuff you're hearing from me. And you call it the underground, right? Like, for a reason. It's because we're worlds that don't talk. And I mean, conspiracy theories have been around forever. Like, that's not going away anytime soon. Um, and there have been evidence, there have been episodes where the public feels really strongly about something and medicine pushes back probably a little too hard. And that, I think, facilitates mistrust. And, there are sometimes things that come up in the oncology community where people want to do something or they want to not do something. And, the evidence is just young and you don't have enough to make a bold claim. And, but, you see people pushing it really, really hard, sometimes on the patient side and sometimes on the provider side. Like, we're all subject to our own biases. And like you were mentioning before, you see healthcare providers pushing things really hard that are not evidence based. Well, people are just trying to help, and people are people.
Hmm.
We're all flawed. We all have these tendencies. But it does make it all the more confusing, doesn't it?
Yes, it does.
And I wonder, for the people who are pushing the cures, and I think that's an easy one to talk about because they're never right, to my knowledge. I've never heard of one that, it stop, take more or take less of grapeseed oil. And um, what do you think they're getting out of that? Like, why do it?
I think monetary gain in
Like,
most
clicks
cases.
they get.
Yeah, yeah. So like people will have a certain program that they charge for,
Hmm.
or they have an actual like physical institute you can go to, and at the end of the day, I think it's monetary. Maybe there's a few people that truly believe this, I don't know.
Well,
But
it's
a lot of it's monetary. I mean, there's people that have claimed that are not doctors that they've claimed that they've cured their cancer by doing X treatment, and then they'll want to share their program because they're so um, honored that this thing worked for them, so to speak, and so they want to share it. But oh no, it's not free. They're going to charge you. So yeah, there's a lot of that, which is really crap too, because it guilt trips you into thinking like, oh, should I pay that $20 to find out that little bit of extra information that might give me more time? Or I don't know.
yeah,
There's a lot around. I say about curing my cancer, but there's also a lot around about cancer stem cells, which I think is another podcast on its own. But
probably.
there's a lot out there about, okay, well, you were diagnosed with stage 1 through 3, and then you have no evidence of disease and you go on with your life, but those cancer stem cells are still there. So how do you get rid of them or ensure they don't come back in a aggressive form to stage 4? And so there are a lot of reels out there about how do
Yeah.
you stop cancer stem cells? How do you kill them? I would love for us to do a podcast on that because I don't know enough about cancer stem cells to talk intelligently. But
Yeah.
there is a lot out there about it. And I think those people are playing into it because people don't really understand what that means.
I mean, and the medical community too. That's a very complicated field. It's a great
Interesting. Okay.
question. Like
Yeah.
it's the perfect question.
Yeah.
Um, and it is a $1 billion question. A lot of people are working on that. But some of our projects I'm on, we're working on that. And I think the thing that's so challenging about that area is that you're dealing with people who are potentially cured. You have no evidence of disease. And if you're pitching a therapy, one of the things we struggle with is how do you know that it worked? Like if you have no evidence of disease and nothing changes, either you were cured from the therapies we gave that we thought would cure you, or this alternative thing helped. So if someone is pitching something in this area, they can believe that it cured you. Like they can make that logical jump with no evidence. And it's tough. Like I do think a lot of these people are really trying to help. And I don't think people realize the burden of proof that you need to really propose someone change their life and do something different based on your recommendations. Like that's such a big responsibility and a weight. And I don't know why some of these people don't feel it. Yeah, I mean, even people getting, I had a family member who developed lung cancer, and I wanted them to come to our institution. They live not too far, and me, like, I was asking them to come out of their way because we had a trial in that area, and I was really hopeful they would come be evaluated for that trial that I'm like very confident would be helpful. And I felt so guilty because I'm like, if their experience is bad, if they're not able to get on the trial, if the trial doesn't help, all that's on me. Like I'm the one that imposed this on them. And I feel the guilt of responsibility of how they do. And luckily things went very well. But the whole time I'm nervous because I proposed this thing and I really, really want that person to get benefit from it because if not, I harm them. And I feel that in a very real way. Their time, their hope. I mean, hope is one of the biggest things that I feel because that is center in your quality of life, is hope. Without that, I can't imagine really having a quality of life. So all these people that are pitching hope and they don't seem to have the burden of responsibility of that being true. I don't follow it. But there's a lot of it out there and I just don't understand it. And I think it's probably because they're not caring for patients.
Right.
That they're not watching people they care about pass from this.
Yeah, absolutely.
So yeah, it's probably a lot easier when you're removed, huh?
Very much so. Well, I'm looking forward to diving a lot deeper into specific items on this topic, because I think it's going to be interesting. And when we unpack the different items, I think it's going to give people a different perspective. So I'm really looking forward to diving deeper.
Yeah, me too. Well, thanks for joining us. I think this is probably a good place to stop, huh? Thanks for joining, everybody. As always, please like, subscribe, and you can visit crackingcancer.org for more information or details on how you can help. All of our profits go to supporting the podcast, and excess goes to cancer research. So hopefully you can join us in our initiative, and we will see you next time.
Thank you.
Bye, everyone. Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.